Hello, I'm Bob Denton, and welcome to another conversation. Mental health experts say that college student mental health is in a state of crisis. By nearly every metric, student mental health is worsening. 60% of college students meet the criteria for at least one mental health problem, and 77% of college students report experiencing moderate to serious psychological distress. Well, joining me to discuss the mental health challenges of college students is Brian Lusk, Director of Student Counseling Services at Radford University. And thanks so much for being with me.
Thank you for having me for this important conversation. I appreciate it.
Well, you know what I was struck by, the scope and magnitude, preparing for our conversation. I don't know that I really realized, quote, the crisis that they're saying.
Right.
And it said that over the last decade or so, we've been seeing an increase, but it seems especially post-COVID. Is that what you've seen?
I definitely think so. I mean, COVID complicated everyone's lives, all of people's lives. If you think about it, even the simplest things in our life that we used to do to cope, go for a walk, maybe visit the grocery store, it became really complicated. We had to plan to go to the grocery store, when to go, how to go, what to wear, what not to wear, who to touch, who to interact, just all kinds of things. So all the easy things in our life became complicated in addition to things in our life that are already hard enough to deal with. So I definitely think that played a role. And
you know, it seems like, and I may get in trouble for asking this, and you can correct me, that it seems like Gen Z is kind of a fragile generation or something.
People would say that, but you know what I say to people is, let's think about what they grew up in. Okay, this generation grew up post 9/11. They grew up post Columbine, all the mass shootings. Parenting is very difficult. I have an 8-year-old. Parenting is not easy. And I think when all these things happen in our nation, people started parenting their children differently. They started holding them more closely to themselves. And like they call them the helicopter parent, some people call them Black Hawk, parents. And I think people parent differently and they're more involved in their kids' lives for better or for worse. And also think just our nation in general, the anxiety has gone up because of the things that have happened. Previous generations have had to deal with significant things. World War II, the Great Depression, Vietnam, a lot of things like that. But for the most part, those things happened off our soil. They were not happening in our country, so a lot of people felt safe in our country. And then Columbine happened in '99, 9/11 happened in 2001, and things really hit home. No longer was those things happening elsewhere, they were happening in the core, the heart of our country, and it rattled everyone. So I think what you're seeing now is a product of kind of the trauma our country's experienced from all these events that have happened in the last couple of decades, if that makes sense.
It does, and I'm assuming that post-COVID and even prior to, you're having to dedicate more resources for counseling and help.
Right. At Radford University, it's no secret. Our enrollment has continued to drop since 2019 for a variety of reasons. Despite that, the number of students accessing our resources at the Counseling Center have continued to go up substantially. I just ran our first 6 weeks of fall today compared to the last 5, and our numbers were at historical levels at Radford University. Students, it's a blessing and curse, I say. Students are more in tune with their mental health. They're more willing to seek help for it. But it's also taxing our resources. It taxes my staff, and we have to find ways to, change the way we've traditionally done things in order to meet the demand on campus.
Wow. Well, let's talk a little bit about what are some of the most, so we can understand, what are some of the most common forms of mental problems
struggles
among students?
Right, so I think depression and anxiety you mentioned. I think a lot of people don't forget about the aspect we all have trauma in our lives, right? And I think for all of us, the way we behave as adults as we grow older are rooted in our childhood, things that have happened to us. So something that happened to me I may find traumatic may not be traumatic to you, and vice versa. And people need to realize those are precipitating factors that put someone into facing depression and anxiety. We also have some more significant struggles, PTSD, people come in with post-traumatic stress disorder. We have some people with some other schizophrenia, bipolar. We see people also coping in different ways, which leads to additional issues. So there's just a wide variety that we're seeing now that probably we're not seeing or not diagnosed previously.
Well, what also blew me away in a way is self-harm.
Right.
Maybe about 12% of college students, but the stat said 33% of students who received mental help considered suicide. That is an incredible and sad number.
Right, and it's definitely true. We've seen that in our student body. Students come all the time. They have either a plan or they just have the thought, but it's definitely there. And I would say all of us in our life maybe have considered that at some point when things have gotten really bad. When I was a kid, when growing up, I had a girlfriend break up with me. And in relation to that, I, wasn't serious, but I had fleeting thoughts, would it be better if I wasn't here, instead of going through the pain of this breakup? And I think all of us experienced that, and I just think this generation may be more willing to talk about it because of the work we've done as professionals in our field to normalize things around suicidal thoughts, self-harming thoughts.
And is there a particular group that appears in need or utilizing resources more? I mean, for example, men versus women.
Traditionally, women definitely come into counseling more because as men, I was taught, maybe you were too, is rub some dirt on it and get over it, especially growing up in the South. Don't show your emotions, crying is weakness, be strong, be tough no matter what goes on. So I think we're breaking down some of these barriers now, but still we're seeing a lagging in men seeking help than compared to the females in our society. But it is increasing, which is a great thing because men need counseling as much as women.
Absolutely. And what about freshmen? Or you look at what classes? Is it the freshman class a little bit more than sophomore? In other words, just trying to get a sense of where the demand is.
I think it's for us at Radford, I can't speak across the country, but I think for us it's pretty even. We do see a number of freshmen come in after the first couple of weeks. A freshman, especially if they're moving away from home for the first time, they're living in a dorm, they're taking academic classes, which are generally tougher than what they've experienced in high school. And then they have all the other pressures, academics, money, having to pay for things, being on their own, figuring out how to get from here and there. And again, we talked about this generation, parents holding their kids more closely and doing more stuff for them to protect them with what's happening in our country. So students are coming to college not quite as prepared to be independent as they once were, and that just adds to the anxiety and stress that they're already facing and the other aspects that college students have faced previously.
And so some of the triggers, let's go over those again or mention a little bit about what would trigger some of the concerns among the students. Is it more about relationships or is it about academic pressure or those kinds of things?
So I think at the very baseline, the foundation is the relationship issue, whether it be with family, friends, or we have a lot of students who come in with family issues. And when you don't have a strong support system or your support system is not consistent or it's not solid and anything gets in your way, like academics pop up or just any issue, it just complicates things. Like you struggle to cope because you don't have a strong foundation. I was very blessed growing up. I had a very strong family foundation. And when stuff came my way, I was prepared to tackle it. Now, I didn't do it perfectly, and I had struggles, but I was definitely, set up to be successful. And I'm seeing less of that in our students, and I think there's a lot at play into that. There's a lot of family dynamic things that go on in our country, and students are just not prepared because they don't have that foundation to help support them through that. They're missing, people call it grit, it's also called resiliency, and I think our students, they're struggling to find that for whatever reason.
So there's less embarrassment about seeking help now,
Generally.
which is, you're finding that generally.
Yeah. I mean, students are more willing. I think that's one reason we're seeing more students in the counseling center. I think if you go back 30 years, people needed as much counseling then as they do today,
Yes.
but they were just, less likely to seek it out because of, if I get counseling, it shows I'm weak. It shows I'm incapable. I can't function, that type of stuff. And we've done a great job as a society with all of the ad campaigns and public, pushing mental health awareness. It's okay not to be okay. You may have heard that. And that's something that we talk about mental health. It's okay not to feel okay all the time. So because of that, our students are definitely coming in to college campuses more in tune with their mental health and more willing to seek help. There's also more students coming to college that have already had counseling for a number of years prior to getting to college. So they're coming in and they're wanting to continue that, and now you're adding all this new onto it, which is continuing to complicate their lives, being at college for the first time. Go ahead. Sorry.
Well, no, and so now explain what some services available beyond just the counselors. What are some other things that try to provide mental health for the students?
So I think at Radford there's a lot of things we try to do. We offer something called Let's Talk, which is it's informal consultation. So students don't have to actually come and connect with a counselor and start official counseling. They can go see a counselor on their own turf in different buildings and get a feel for what it's like to talk to someone. And maybe it's someone who doesn't need ongoing counseling. They're just having a problem that day. So they can pop in, talk to a counselor, maybe they don't show back up, and that takes care of it. We also offer, we're building toward having calming rooms or calming spaces, and I think a lot of schools already have this. It's really popular in K through 12. It's just rooms or spaces across campus where students can go and relax. There's music, there's lighting, there's all kinds of things in that room to just allow them the opportunity to get away from whatever's bothered them and be by themselves for a period of time, and to kind of do some meditation, some self-reflection, just to kind of calm themselves away from, because you think about it, on a college campus, most people have roommates or they're in a residence hall. And that can be a pretty chaotic environment with all the things going on, right? So it's hard for them to find that calming place in where they're at on college campus. So having these calming spaces can play a huge dividends in helping them, find that center and help them go about their day and get some grit about themselves. If that makes sense.
It does, and I'm assuming also there's a lot of perhaps workshops on like time management that would
Yes.
reduce how to take care of yourself, reduce stress and all that. And so there's a variety of these kind of programs available.
Right, and we do those. We don't do them as much as we'd like to because the demand in our counseling center is just so high. I need my counseling staff in the center meeting students coming into the counseling center. But we have great partners across campus that help us with those type of educational programmings, and we do it upon request. Ideally, I would love to be able to have something like a workshop every single week someplace, even in the residence halls. But at this point, it's just not feasible for us because we have to be in the counseling center because that's where the students are coming to meet us. And if we're not there, we're not going to meet that demand, and then we have a bottleneck. I'm really proud of Radford because, I started there in March of 2019 and there was a bit of a waiting list. And I got there and I was like, we can't do wait lists. Mental health does not wait. So we had to readjust some things. And for the past 3 academic semesters, we have seen students that want to be seen within 24 hours, if not same day. And that's the only students, again, have not been seen 24 hours or ones that chose to maybe wait a couple extra days to get an appointment. But I'm proud of that because we're seeing a higher demand, but our staff is meeting that demand and we have a fantastic staff. And I think that's happening all across the country to various degrees. I mean, people are struggling depending on the size of their enrollment, the size of their staff, but we just have to be really creative in how we operate to be able to meet the demand because, we talk about resources and I feel really supported by my campus, but sometimes the financial piece of that resource is just not available for various reasons. So we have to make do with what we have, and I think we do a great job of that.
And there seems to be a lot of this online
Right.
type of services, and some institutions I saw, well, they cannot find enough counselors to help.
Right.
And the ratio is already 120 per counselor, something like that.
It can be high.
And so some universities and colleges are giving a number of these digital or streaming kinds of interactions.
Right. I think students that meets our today's students. Today's students are vastly online, right? They want to be online, they're on their phones, they're on their iPads, they're on their laptops. So for a lot of them, that works well. And a lot of campuses are finding success in that and it's helping take the burden. What we found at Radford is we offer the opportunity for our students to see our counselors, what we call telemental health, and most of them do not want that at Radford. Most of our students at Radford, they want to come be seen and see someone in person.
Wow.
I think the last couple of years, the percentage has been like 97% of sessions have been in person. The other 3% or a little less have been virtual. And usually they're only virtual if a student's not feeling well and they still want to be seen. So we say, well, don't come into the counseling center and spread something that you don't know what you have. Let's switch you to a Zoom session and we'll do it over Zoom, and it works well for us. But generally, our students want to be seen in person, which is kind of counter to what we know about this generation of students. They prefer that virtual piece, but our students do not. Our students at Radford do not.
Well, so we accept students who come, and we don't know necessarily their past because they don't have to reveal that, true?
Correct, yep.
And the problem if a student wants to stop taking medication, is that a high incident of like, okay now, I mean, and you can't make them take it,
Correct.
per se.
Yeah.
Well, is there ever a time, and I'm probably not saying this the most polite way in the world, but are there certain traits or continual problems to the point of saying, I'm sorry, you cannot be a member of our community
Right.
because of your own safety to others, and we can't handle it? Is there a process that can be followed that sometimes it may be a student you just have to say, I'm sorry, you cannot be here?
Right. Well, so I think some universities do have policies where they'll put people on like medical leave. Radford doesn't do that. And not that we're any better, but we just try to wrap around and give students what they need supportive-wise. We have a lot of teams that come together and provide like comprehensive case management to our students. And as a part of that, we may make them, you need to do these things. You need to see your case manager. You need to go make sure you're seeing your psychiatrist. We do those things. And if they do not do those things, then we have other recourse for being able to move them in a different direction. But also, Bob, if a student is struggling that significantly, academically, they're not going to succeed well enough to stay enrolled. So it's kind of going to, nature's going to take its course, and academically, they're not going to continue there at the university because they'll face academic suspension long before they face any other type of suspension from school. But it is a possibility, and it does happen some places.
Well, let's talk a moment or two about the role of faculty.
Right.
And they're kind of the first line of defense in a way.
Definitely.
But boy, toward the end, and as an academic administrator, there was faculty saying, I don't want the risk. I'm not a professional.
Right.
And all I can do is make a referral if they don't do it or what have you. But the role of the faculty, I'm wondering if there's certain academic faculty development training for some if they would like to take it and stuff like that.
Yeah, we offer those trainings all the time. Mental health first aid is a certification that may be provided, but for the most part, we offer our faculty, we talk to them about how to work with students in distress, right? Because you're exactly right, they are not professionals, and I stress that to them all the time. Their job is to give a student a minute or two of their time, truly hear what they're saying, empathize with them, and then say, hey, I have some colleagues on campus, I know some resources, let me walk you to those, let me call over there. And we have faculty all the time that are walking students to our office or calling us with the student of concern, and we're navigating how to get that student to us. But faculty, I mean, they don't want to be a part of it, but faculty, today's world, faculty can't ignore that, right? That's a huge liability for everyone, and it's going to bubble up. So faculty need to be prepared to at least provide those couple of minutes to hear a student out, and then provide the support they need to get them where they need to go. So being empathetic, building that connection. And in some ways, I think it's an honor for a faculty member to have a student come to them, and faculty may be thinking, no, it's not an honor. But if a student trusts you enough to come share something that profound about their life with you, that speaks volumes about how you're presenting that student, and that student sees you in a certain way. So while it's anxiety provoking for the faculty, it's also, some appreciation in another human being's confiding to you, they're struggling and they're not doing well, and they're reaching out to you for help.
And the faculty said, well, am I legally protected? I mean, maybe, is there some risk there, or is there protection for faculty members? You see what I'm trying to get at?
Yes.
There's a lot of faculty saying, boy, litigious as everything is,
right.
I don't know. If I say, you need to see a counselor, what do you mean I need to see? What's wrong with me? You see what I'm saying?
Absolutely. So I think as long as faculty is reaching out to someone, whether it be the counseling center, a lot of places, Dean of Students office, if they're reaching out to someone and saying, hey, I have this student that mentioned this, I'm concerned about them, then faculty's done their due diligence to take care of the student appropriately. And someone can always sue someone over something, right? But the faculty's taken those steps. Like at Radford, faculty's, they need to call us, call Dean of Students, and if they do those things, they've done all they can do because they are a faculty member. It's like for me, even, I'm working on my PhD currently, and I teach courses. And when I'm teaching a course, I'm not a counselor, I'm a faculty member. So I have to respond differently to a student. So if a student comes to me and says they're thinking about harming themselves, I don't immediately go into counseling mode. I get them connected with the counseling center or someone that can help them, because my role at that time is a faculty member, not the counselor, right? So as long as we're doing our due diligence as faculty, then we're doing all we can in getting them connected. And there's always the possibility of litigation, but you're really helping yourself by, again, not ignoring it. Because ignoring it, if a student comes to you and you don't say it or do anything about it, that becomes an issue in the back end. And that opens you and the university and other people up to liability in litigation.
Well, this is perhaps more about behavior, but it's still related in terms of drug abuse.
Right.
And back in my day, I guess it was always binge drinking or fraternity parties or something like that. You had to be on this scene now with fentanyl, with all the different other drugs. Cannabis is coming along pretty quickly. Yes. Are you seeing, what does that look like today in terms of drug abuse related to mental health?
It's a coping mechanism, right? It's a symptom of a larger issue, and a lot of people struggle with that. Prior to coming to Radford, I worked in addiction counseling for about 7 or 8 years. So I worked with that exclusively. And that is largely a symptom. People trying to cope with their life, they're trying to survive life in the best way they can. And again, for people that don't have any better coping skills, they get turned on to something like a drug, whether it be alcohol or something else, and they find some kind of comfort in that. Now, long term, we know the consequences are significant. But despite that, in that moment that they're using that substance, they're getting some comfort. So we're definitely seeing that. Our students do that. Marijuana is definitely a popular one because it's become legalized. And students are battling with how does that work? Because it's legal if you're 21, right? But you still can't have it on a collegiate campus because it's not legal on a federal level. So we definitely see that there. The great thing about Radford is we have a collegiate recovery community in one of the other departments I oversee. So we have a number of students who are either moving toward recovery or are in recovery, and we just support them. We have a peer who works with them one-to-one when they're struggling. They can call the peer, outreach to the peer. We offer groups, we offer individual counseling, and then if it's something more significant where they need more than we can provide, we connect them to the community service board in our area. And a lot of college campuses in Virginia now have a collegiate recovery community. So that's a really huge positive. And I'm glad campuses are now acknowledging that this is the problem, because for a long time, people just kind of, no, our students don't have a drug problem. Our students don't drink, right? But that doesn't help anything, ignoring the problem, right? We've seen that. So we have to get out of that old way of doing things and start acknowledging what is and dealing with what is.
Well, let's shift a little bit to parents and their role. Can you, and I know it gets legal, because if they're over 18, are you limited to what you can call the parents and say, look, your son, your daughter really needs more intervention, more care? Or is your hands somewhat tied because of being 18, or if they didn't sign a disclosure? Help us understand that for the parents who kind of know, when can should I be alerted if there's a crisis or something going on?
Absolutely. So, we tell our parents, first of all, if you as a parent's concerned about your student, you can always call us and tell us as much information as you want. But we can't do that without a release. So what we do is, if parents or a family member are a positive influence, we always encourage the student to sign a release so we can involve them in their treatment, right? If they don't sign the release, unless they become a threat to themselves, which is, suicidal, homicidal, psychotic, hearing or seeing things, if they don't rise to that level, we cannot breach confidentiality for any reason whatsoever. So until they reach that threshold, we encourage students, and that's all we can do. I will say for some of our students, involving their parents or family, that would be problematic, because honestly, that's part of the reason why they're coming in. They're not feeling supported, they're not feeling heard by those individuals, and it's perpetuating the struggles they're already having. But when at all possible, we definitely try to involve parents. And if you are a parent and you're concerned about your student, again, please reach out to their counseling center wherever they're attending, the Dean of Students office. Share as much information as you can, because sometimes we don't know what we don't know, and the student may not be forthcoming with some of that. Did that help answer your question?
It does. And so it can go both ways, and that's what one wants to hear. So, and the 4 minutes or so we have remaining, as you're looking to the future, problem is just going to grow? Is there going to be enough research? In other words, have some thoughts about what you think the future will look like in terms of need and challenges with college student mental health.
I don't think it's going to dip. I think it's going to continue to steadily incline. At what rate depends on what's going on in our world, right? But I think as college counseling center directors, we have to be creative in how we're delivering services. We have to get outside the box. We have to look at not doing what's been considered normal. And most college counseling centers don't bill insurance. So we're not under a managed care microscope. So as long as something is ethical and legal, as I tell my staff, we can try it. We can be creative in how we're delivering counseling. We can do walking therapy. We can do shorter sessions to accommodate students. We just have to be really creative and figure out a way to navigate, because resources financially may or may not be coming. And I also don't think we can outstaff the problem. I don't think we'll ever outstaff the problem, because a lot of the campuses that have connected with some of these online resources, they're even struggling to keep up with demand, even with that and the counseling center helping with their students. They're having the limit. They're struggling to find providers to meet with the students. So, staffing is one thing, but if you're relying solely on trying to outstaff the problem, you're never going to do that. So get creative. I think coming together, the governor had a thing down in Eastern Virginia a couple months ago, the Mental Health Summit for higher education, to talk about ways we could meet this demand head on. And as long as that talk actually goes someplace and we do something with it, I think there's lots of great possibilities out there, but we have to be willing to be cutting edge and get out of that old school way of doing things. And that makes people uncomfortable. Yeah,
and should we say something about high schools? I'm assuming that the high schools are really not having near the resources that could help, but that would help. The sooner problems would be identified, sooner they'd get help. And so I wonder if you have thoughts about high schools and their high school counselors.
That would be amazing if we could do more counseling in high schools. I know, like back in New River Valley in the Radford, Blacksburg area, it's hard to find providers that can provide care to like adolescents. Like let's say 14 to 18, 14 to 17. I have some folks in my office who have, 14, 15, 16-year-olds that are really struggling with a variety of issues, and they have had a very, very difficult time finding community providers. So if somehow we can figure out a way to staff high schools with counselors and increase that their accessibility to counseling in high school, that would be wonderful. Now, financially, I don't know how feasible that is, because that can get pricey, and we all know that where things are at economically with our country. But that would be an amazing opportunity, because in the community right now, it is seriously lacking in our community back in the New River Valley. So it's a struggle. Anything would help.
So we literally have a minute left or so. Any final thoughts that you would share?
one thing in closing, and this could be a whole session conversation itself, but I think, you know, we as a society need to become more trauma informed with how we operate. You know, historically, you've seen someone doing something and you want to ask, what's wrong with that person? But we need to stop asking that and start asking, what happened to that person? It's a different way of looking at things, because all of us carry our own trauma into society. And the more we know about trauma and the way it impacts people and the way they present with it, the better off we'll be as a society to be more successful and temper down some of the struggles we're seeing now.
Well, thank you so much. Believe it or not, that's all the time we have. I do want to thank my guest, Brian Lusk, for joining me. And as always, I want to thank you for joining us and hope you do so again for the next conversation with Bob Denton.